Hi there, my name's Carl Wheel. I actually hold a master's degree in anaphylaxis. Big word, almost a little hard to spell, but it's very simple and basic. Anaphylaxis is a severe, life-threatening emergency that can actually cause death. All of us have allergies. We all sniffle a little, sneeze. Could be the pollen in the spring or the pollen in the fall. But anaphylaxis has a number of things that can trigger it. One of the most common, just grabbing here, a little bit of granola, well, peanuts. And even if you buy the granola that has no peanuts, there may be peanuts in it. And peanuts are the most common food. This short video course will allow you to have the useful knowledge to be able to handle this emergency situation. Those who want to go further can take our course 2, and we can give you a test after you've finished it and a certification or card that you might have use for depending on your job. But this first course will give you the knowledge you need to be able to handle recognition, assessment, and treatment. Okay, so we talked about the various triggers that could happen. We also talked about that this could be a first-time exposure. You've never had a problem before. Maybe you never even ate shrimp before and you eat it now and bam, you have a problem. Or it could be your, like my friend, maybe 100th, maybe several 100th time you've done it. So there is no easy way to test. There is no predictability. What we do know is it does happen. And there is one drug that saves the life. That drug is epinephrine. Epinephrine comes in auto-injectors. We'll go through first recognizing anaphylaxis. So there are 5 basic aspects. Next one is if we end up eating something, or the patient does, that they know they shouldn't have eaten. So they thought they had peanut-free granola, but it was made in the same factory as the ones with peanuts. They've got minutes, possibly. So that one, coupled with one of those 5 signs, and you need epinephrine. We're going to go over these devices now. I'm stepping over here to the right, so you can see my right leg. Now I have to think about, and temporarily, I'm going to hold it in the other hand. Have to think about down here on the outside of my thigh, which is between the jean seam, which is about 3 o'clock, and the top of my thigh, which is 12 o'clock, if you're thinking of a clock, halfway between my knee and my hip. I'm going to go midpoint. But I have to think, is there something there that I could maybe interfere with, like a pocket knife? If there isn't, that's good. So I take this and I place it, not in my finger, but in my mid-thigh, and I push. This is a trainer. I push firmly, you heard a click, and I can count to 5, and that's probably plenty long enough. The old books used to say 10 seconds, the new ones say 2 seconds, 5 seconds, great, and then I let go. Notice how this orange piece has extended. It's covered the needle. There's the trainer before firing and the trainer after firing. The real one will do the same thing. I hope this helped you and gave you some confidence and some comfort in this possibility. Remember that even though it's out of date, it's still good. The epi is still good. What you do want to do, though, if you have the problem, is to get a new prescription every 18 months, as it has an 18-month shelf life. We'll look forward to talking to you on our second video, should you want to do that, to go forward and get the certificate that some states have recognized, about 30 of them now. And some states, like California, actually require, in order to be able to do this. To get the epi, the epinephrine, or these 3 devices, you need to have a doctor write you a prescription, and then you can go to your favorite pharmacy, and should you have reasonable health insurance, it will pick it up. There are books such as ours that talk about everything I've just talked about. This little book and a waterproof book is available from us. and it does go through how to do everything we just talked about. Thank you for your time and for helping your neighbors and your family by learning this.